Hi, and welcome back to the Tooth Doctor YouTube channel. Thanks so much for joining us. Today, I'm here with Dr. Peter Yoo. He is the Tooth Doctor, and today we're going to talk about the top 10 reasons for dental implants. So, you are today where your thoughts have brought you. You will be tomorrow where your thoughts take you. That's James Allen. We always like to start with a motivational quote. Okay. Get our minds in the right places. According to numbers from iData Research Inc., around 90,000 dental implant procedures were performed in 2005. So it's probably way more than that now.
Wow.
So Dr. Yoo, that's high. Dr. Yoo, how long have you been helping patients with dental implants?
I worked for a dentist for 5 years before I owned my own practice. Mm-hmm. And he loved doing implants, loved doing surgery. Just, that thrill. And so just to watch him, I've heard of people taking courses, they spend thousands of dollars to go watch these dentists or specialists doing implants. And I got it for free. Wow. I basically go in, I finish with a patient or a filling, and I walk over and I see him place 3 or 4 implants, and it was like a slam dunk kind of situation. And so that's kind of where I first started. So I can say I've been doing implants for a little over 10 years, and it's been good. It's been it's been a good challenge, but it's been very rewarding. All the people that I've worked on, very few have had any issues, and most of them, if any issues, very mild issues.
Okay.
So, yeah.
Good. So reason number 1. The top 10 reasons here we're talking about for dental implants. Reason number 1 is that dental implants help preserve bone and gum tissue.
Mm-hmm. Yes. People always think, if I lose a tooth, what's the deal? What's the big deal? And it's not, it's not like life-threatening per se. But the issue that we have is that your teeth, they actually hold the bone, they support the bone around it. They actually, every time you bite and chew, it stimulates the bone for it to stay nice and healthy. So when you lose a tooth, now there's nothing around that area of the bone to stimulate it, and that's why the bone will start to shrink away. So having an implant there where it allows for that natural stimulation will help to keep the bone healthy and thriving in that area, which also protects the bone for the teeth beside it, right?
Right.
So,
okay. Reason number 2, dental implants protect your healthy teeth by distributing biting forces.
Yes. Yeah. I just saw a patient today. This patient actually broke a tooth on the one side. And so without even thinking about it and knowing about it, this patient actually only chews on the other side, right? Yeah. Because it's kind of awkward to chew on the side with a broken tooth. Mm-hmm. But what ended up happening is overuse on this side. This patient actually cracked the root of one of their molars, and now it's infected. They are on antibiotics, and they had to get that tooth taken out. So having implants allows even stress and pressures of the bite of all your teeth to help you chew properly and just give you balance.
Right. Makes sense. Okay, reason number 3. Dental implants prevent your teeth from shifting.
Yes, all our teeth are in balance. Okay, when you lose a tooth, those 2 teeth beside it, when you lose the tooth in the middle, the teeth, there's nothing holding them back. So what they can start to do is they can start to drift. Okay, the tooth above it that you bite on, when you lose that tooth, then that tooth will start to come down. Okay, and it affects the whole balance of your bite. So placing an implant and restoring those missing teeth will allow for proper and complete balance of your bite, so that you're not getting shifting of the teeth.
Okay, so reason number 4. Dental implants prevent bite collapse, saving your smile and appearance.
Well, bite collapse, people are like, what does that mean? Well, what happens here is that most people in general tend to lose teeth in the back. And they're like, oh, well, I can't see it, so who cares? Well, what do you do if I, chop one of your legs off, right? Like, you're gonna have more stress on the other leg, right? So when you lose teeth in the back, then eventually you put more pressure on the front teeth, and now there's more wear, and more wear causes the bite to slowly or I guess you should say more quickly, reduce the height of your bite or the opening of your bite.
Oh, okay.
Right.
Okay.
In regards to saving your smile and appearance, that's the same thing, right? When you have, your back teeth are meant for chewing and eating. I've seen so many people that have no teeth in the back, they don't want to wear a denture or get implants or whatever, and they just chew on their front teeth. And they literally just start wearing away because they're chewing.
Eroding
just wearing the enamel down.
Wow.
And then it affects your smile. You smile and you have a chip on your tooth, and it's just not pretty.
Yeah. Not the way it's meant to be, right?
Mm-hmm.
Okay, reason number 5, dental implants don't decay.
Yes. Yeah.
That's actually a
That's
great
easy.
feature.
Very straightforward.
No kidding, you don't really need to sell that one, do you? Okay, reason number 6, dental implants are long lasting.
I believe that dental implants compared to other treatment is longer lasting. Okay, when people hear the word long lasting, they're like, oh yeah, 1 implant for the rest of my life. Well, you know what, when's the last time you had a car for the rest of your life? There are probably few, maybe 1 in a million, that actually have a car and they use it and take care of it for the rest of their life. And that's the key word, taking care of it. Anything you get, you want to last longer, you have to make sure you take care of it and maintain it. And same thing with your implants.
Yeah, that's right. Okay, reason number 7, dental implants improve the ability to chew and speak.
Chewing, if you have teeth, they actually say that when you have a full upper denture or like any complete denture, top or bottom, your bite power reduces by 80%. Okay, so you're actually only using 20% of your actual full biting power because people are kind of, I don't know, it's just a thing that your body, your brain kinds of compensate.
Oh, okay.
In terms of like reducing the power so that you don't damage anything or something like that. It's just not the same feeling. So having an implant in there, it's like a natural tooth. You naturally want to chew with the same power. Okay. In terms of speech, when you start losing teeth, it does affect how you, say certain words and letters, and it can affect the way people hear you.
Yeah. Okay. Okay, so reason number 8, dental implants eliminate the need for removable dentures.
Eliminate the need for removable dentures, yes.
Yeah.
You could get a denture, you can get a bridge, or you can get an implant. So one of the key things with implants is that it stays in your mouth. It's like a natural tooth. It's designed and maintained so that you don't have to take it out. A lot of people are like, oh, well, it just costs too much. Well, I'll get a denture. Well, having to take something in and out of your mouth, basically the proper way of doing it is you're supposed to take it out every time you eat. So that after you rinse it and clean it, put it back in your mouth so that food doesn't get trapped underneath there. So constantly taking something in and out of your mouth is very cumbersome and overall will affect your quality of life. So
yeah, that makes sense. Okay, reason number 9, dental implants are more reliable than any other restoration or tooth replacement.
There have been studies that talk about implant success. Okay, numbers that I've grown up with and that I hear is usually within the 95 to 98%. Okay, so that is very high. So when I was growing up and in terms of my dental career and experience and education, to me, implants were very, very successful. The way the machining, the preparation and the making of implants, the precision that is required for things to fit, for each piece to fit properly, for all that stuff, it's very precise and it's very specific, and so that's where it becomes a very the success is in the research. The success is in the numbers. Okay. When you're looking at micrometers as opposed to millimeters or inches, there's a big difference, and they try not to leave room for error.
Okay. Almost sounds better than an actual tooth.
You know what? There are very many things, and I appreciate you saying that because, yeah, you know, you sometimes think, well, if implants are so great, what's wrong with my teeth? You know, there are very important things that your teeth do that implants can't do.
Yeah, for sure.
And just the naturalness of your
Organic,
teeth is very important, right?
For sure.
Tell anybody that's had a hip replacement or a knee replacement, you know what? They'll say, I'm so thankful. You know, it makes a big difference.
Quality of life.
Yeah. But you know what? They can still remember a time when their knees were good, or their hips were good. You know what? You don't ever want to get away ideally from something that is natural.
For sure, yeah. Reason number 10, dental implants look like your natural teeth.
Yes, more and more with aesthetics,
Yeah.
dental labs, dental ceramics. They're making the crowns, the crowns that go on top of the implants, and just their overall shape and positioning to look as natural as possible. Every time I go to a course, you know, they'll show these teeth, and you know, the instructor will show a picture, and all the dentists will look at it, and he'll say, "Which one is the implant?"
Yeah.
And you're looking like, that one, that one, and never 100% is right because it looks so natural.
That's good to know.
Yeah.
Lots of options now. Well, thank you so much for just kind of reinforcing all those top 10 reasons for dental implants. I appreciate it. Don't forget to like the video and subscribe to the channel, and you'll get lots of more great information from the Tooth Doctor here in Edmonton with Dr. Peter Yoo. Bye.
Bye.